Yeah, so what makes a good IP is someone who definitely executes critical thinking within their daily workflow. But it's also someone, because I know, we have there's this notion that we are the police, right? And that notion came from somewhere, based on how that the role is executed. So definitely, as I noted previously, being someone who is coming as a partner and having that be your disposition when you navigate multidisciplinary stakeholders. And that's a key to being a successful IP, is being able to navigate between multidisciplinary teams and individuals with various personalities, various backgrounds. Yeah, so someone that will make a great IP is someone that can navigate various interdisciplinary. And it doesn't mean that you're someone who's extroverted or you're loud spoken or you're always the person to be at the front of the ring. That's not necessarily true, but you are there to be a contributor, a positive contributor to the initiative working towards advancing patient safety and, the hospital metrics. You're also someone who, in my, from my purview, is someone that has a heightened sense of personal or self-ethics, right? It's that notion of doing what is right, even when no one is listening. We come across a lot of things within our profession, and we come across a lot of areas of opportunity. So being strategic about navigating that and presenting that to leadership with the subsequent goal of having it addressed for everyone on safety. Also, I think that being an avid learner to a certain degree is absolutely integral. We come across a myriad of situations, instances. We cover so many aspects of healthcare, and quite frankly, I will speak for myself. I'm not an expert at every single component that we touch. So it's being an avid learner, displaying a questioning attitude when you're engaging staff, opposed to, saying, well, I'm the expert. Really being engaging with the healthcare team to really seeking to understand their insights and ways in which there's potential barriers within their work. We can partner through more so than, believing that any of the issues that we may identify is an individual issue. It's based because of that person. We have to be process focused. So having someone that is process focused and assessing processes. Of course, in rare instances, there might be an individual, situation that must be addressed, but more on focusing on the processes and being strategic and really being willing to learn, consistently being willing to learn and advance your knowledge in the IP